Welcome, everybody. Thank you for joining us. Today's session is Mindful Multiple Choice Self-Care Strategies for Faculty and Staff. And we are very fortunate to have Beth Cholette, who is a clinical psychologist and certified yoga instructor. Beth is the Assistant Director for Counseling Services here at SUNY Geneseo. And Beth and I have been working for the past couple of years on ways that faculty can help incorporate mindfulness strategies into their classes and also just into their daily professional lives as well. As we go deeper and deeper into this pandemic, it is probably even more important to focus on ways that we can be mindful at this time. And so Beth has been very generous with her time in helping us think about strategies to do that. So with that, I will turn it over to Beth Shellett.
Thank you, Dave. So Dave gave me a nice introduction. I am a clinical psychologist. I've been at Geneseo over 25 years. I haven't been a yoga teacher for quite as long. I've been teaching yoga for about 5 years, although I've been a practitioner of yoga for over 20 years. And I have found since I became a yoga teacher that teaching these interventions, whether in therapy or when I'm teaching yoga class, they really go hand in hand together, that these are sort of lifestyle skills, not just applicable to one area or the other. I will say the one thing I do like about Zoom, although I agree I'm kind of tired of Zoom too, is given that I see students for therapy and I have a clinical schedule, it does make it easier to schedule these outreach programs in between my clinical schedule because I'm not running around to different places on campus. And that being said, I've come to classrooms, I've come to departments. If you're ever interested in having something similar, I tailor programs for different groups, feel free to let me know. So in the interest of tailoring, especially since we have a relatively small group today, if you don't mind, I would like to hear a few words about just what brought you to this program before I go on and talk about what we're going to do for this program. Anyone can jump in.
I can start maybe while people are thinking about that too. This has, I think, been something that is more and more important to me as I work with faculty and staff. We have so many demands on our time, so many demands on our schedule. I think it's really important that we educate people as to how to take care of themselves. And when they are in a good place and taking care of themselves, they'll be better able to take care of our students.
Dave.
Hi, Beth. I'm Sarah. I work in the School of Education, actually with Michael also. And I'm teaching my first course this semester. And so I'm just looking for more ways to, interact well with my students, especially in this virtual setting. It's very different. I also, I'm balancing, I just had a baby back in October. So balancing work and taking care of my 2 daughters and just, helping my mental state as much as I can is important for me and for those that I'm impacting.
Thank you, Sarah.
So I'm here because a couple of reasons, actually. I am really interested in mindfulness personally. I do a much better job of teaching about mindfulness than I do practicing. I find that if I'm stressed for with a to-do list that I haven't accomplished with deadlines, then I very typically, the thing that I knock out of my daily routine is that 15 minutes of being mindful when I consciously do that 15 minutes, which now I'm saying out loud, like, why can't you make 15 minutes for something that you actually really enjoy? But anyway, the other thing is, as a professor in the School of Education, I work with students who want to, be teachers, and them learning the lesson that they can't do their job unless they take care of themselves is a really, really important one. And related to that, a former student of ours from the School of Education, former graduate, actually has a mindfulness project. I helped her get a grant for it. And what we did is we bought a whole bunch of children's literature that had mindfulness messages in them, with some meditation, some yoga posing, some just anger management strategies, cognitive behavioral intervention strategies, things like that. And so that's why I'm excited to be here, just to get more resources, see other faces who are excited about this as well.
Yeah, that project sounds great. Thanks, Michael.
Yeah.
I'm in the school business, and mindfulness is something I have never been able to achieve. So I'm starting out on square one. And between all the stuff that's going on and all the balls in the air, it's like, okay, it's more of a timeout. I got to start rearranging things. And so that's what I'm here for.
Thank you, Beth. I'm going to argue with you. I would suggest that you've absolutely done mindfulness already. It just maybe not as consistently or sustained as you would like.
Well, it doesn't feel like it.
Well, let me see if I can build that up a little bit more. So let me tell you a little bit about the program. This will be an interactive experiential program. Part of the reason we called it Mindful Multiple Choice is because we're going to try different strategies. You may not like all of them. They may not all resonate with you. The idea is to give you some different ideas of things you can try so that you can find something that you can incorporate into your daily life. So you can find what works for you. So you can build on some of these skills. And some of you mentioned about sharing these skills with your students. Absolutely, I love hearing, that's why I love hearing about the project Michael talked about, getting students really young. At the college level, I've actually done a program in the past. I think Dave and I did that last fall of last year, of how to teach skills in the classroom or incorporate them into the classroom setting. All of these skills, once you're comfortable with them, they're pretty simple that you could share with others. You don't need to be a teacher. And I would say the first one that we'll do in a few moments in particular. A couple more things I just wanted to say about the things we're going to do. Dave sort of alluded to this about the learning about self-care and taking care of yourself being paramount. Actually, I think you all talked about taking care of yourself being paramount so that you can help others. And so I call that the oxygen mask analogy. You know that on an airplane, you're told to put your oxygen mask on first. And I think that the thing that sometimes gets lost in that is the reason why. The reason why, if you don't put yours on first, you might be able to quickly help one other person, and then you run out of gas. And you might find that in your own life. Like if you don't put your oxygen mask on, you don't take care of yourself, yeah, you might be able to help a few other people, but you're going to hit a wall. You're going to run out of steam pretty quickly. And then it's harder to build yourself back up from that place. So that is the justification for taking time, on a little bit of time. Michael mentioned 15 minutes. 15 minutes is great. I want to show you how to take 1 minute, 2 minutes, anytime you have. When you have longer time, great. But I think it's more important to work a little bit into every day than to sort of save up and be, you've heard the term weekend warrior in terms of exercise, save up and I'm going to do a 5-hour meditation on Saturday. Wonderful if you want to do that. And if you can incorporate it every day, even better. So that's what I'm going to be asking you to do, is to practice some of these exercises with me. And the practice element is important. These, even though as I said, I think you all have had some mindfulness in your life, using mindfulness in these ways are skills. These are skills and they take time, like any other skill. Like lately I've been playing the violin. I don't know why, I've never played the violin as an example, but you're not going to pick up a violin and expect to be good at it. You're going to, you try it and say, oh, I'm terrible at this. You might say the same thing for mindfulness. And you need practice, and you need to give yourself the chance to build up these skills over time with practice. The other analogy I use is it's like a bicep curl, but for the brain. So hopefully none of you have ever picked up a weight, given it one pump and said, oh, I've got muscles now, right? Same for your brain. We need to strengthen those muscles over time. So these are kind of like that invisible bicep curl, very powerful things that you can do once you internalize them a little bit more and learn how to do them. And then Dave also mentioned at the end, we'll take about 10 minutes for a guided visualization to finish after all the brief little exercises. If anyone can't stay for that, I will give you a heads up before we go to that one so that you know if you have to leave. All right. So we're going to do different exercises. I will guide you through them. If anyone wants to go off camera when we do the actual exercises, feel free. I will ask at the end of each exercise for feedback and what it was like for you. So it helps me to hear that and how it's going. So the first one, there's not going to be much preamble because I want to jump right in and see what it's like to experience this. So with all the exercises, I ask that you find a comfortable seat, that you're sitting in your chair in a way that you feel alert, so you're not falling asleep, but that you also feel comfortable. You don't have to be super stiff. You can rest your hands on your lap or your desk or wherever you'd like. This first exercise, I'm going to ask you to tune into your body. This is called Be in Your Body. And as you draw your attention into your body, and that's what mindfulness is focusing our attention. So as you focus your attention toward your body, turn to something in your body that feels neutral, that there's no particular discomforting sensation. So often I use the feet as the example. If your feet are flat on the floor and your feet are not painful or uncomfortable, you might turn your attention to your feet. If it's not your feet, maybe it's your hands wherever they're resting. Maybe it's another part, your elbow. It doesn't matter what part of the body is. I'll use the feet in the example. And as you turn your attention to your feet, notice, or whatever your neutral place is, notice whatever there is to notice about that part of your body. So that might mean your feet are resting on the ground, they're in fuzzy socks, they feel warm. You can give your toes a little wiggle and feel your toes. As we do this, you might already know that your mind, or notice that your mind is wandering. You might be wandering to thoughts like, when is this going to end? Why my feet? That's fine. It might be wandering to something that you have to do after this. Also fine. If you notice the wandering, and you will, simply bring it back to your focus, which is your feet or your object. You might also look for something that feels pleasant in your body. Maybe you're comfortably warm. Maybe you're wearing a fuzzy sweater that feels nice against your skin. So one last moment or two to stay with whatever sensation that you chose to start, whatever area of the body. And then you can take your attention back to me, and I want to see, what was that like? Anybody who wants to share what that just opening brief focus on something inside was like? Whether it was easy, whether it was difficult, whether you got distracted.
Well, I'm here. Sorry. So I'm actually feeding my daughter right now. So it was a little distracting at first, but what I did, I'm focusing on me feeding her.
Wonderful.
And so that's, a nice experience, and to be in that moment and focus on how that feels and what I'm doing. So I wanted to share that.
What a great opportunity for mindfulness is, there's not a lot else you can do other than, obviously you can be at a program, but what a great opportunity to really feel. I assume you're holding your daughter, feel the connection. There's a lot of things that, hopefully pleasurable things, that you can direct your attention to there.
Yeah.
Did anyone find, when they were trying to focus on something neutral, something less pleasant was tugging at their attention? A headache, feeling tired?
Yeah, I did, definitely.
Mm.
I was actually very cognizant as I'm thinking, like, okay, don't think about your back, which hurts right now. So like, get away from that, because that's not a positive thing. And then I was like, oh, where I cut myself last night when I was cutting veggies for dinner. And so I just went through all these different areas of pain before I found like a neutral spot.
Mm-hmm.
And that made me feel very old in that moment.
Oh, I could go through my own litany, Michael. Don't feel bad. And I've got this nagging little paper cut on my thumb too. So yeah, but that is totally normal. And thank you so much for sharing that. So it's completely normal. The reason why it's normal, we're going to say more of this in a couple exercises forward, but our brains definitely have a negativity bias. And the simplest way I usually explain this is, back when we all lived in caves, if there was a bear in a certain cave, like we had to really be hyper vigilant and super aware that don't go in that cave, there's a bear. In modern life, we sometimes act as if there are bears around every corner. There's bears in the room with us right now. That's where, you know, we get our anxieties up to that same level and focus on maybe tiny threats as if they were bear present in the room threats because of this inherited genetic negativity bias. So part of the goal of shifting our attention to something neutral or even pleasurable is to sort of move away from that. And again, I'm going to say more about that in the next couple of exercises. So before we go into the next exercise, I want to again reiterate that your mind wandering does not mean that you're doing it wrong. It is natural for your mind to wander. In fact, in some ways, it's really good, right? I'm glad that your brain is producing thoughts, that you all have the capacity to hold multiple things in your mind. The idea of mindfulness, what's sometimes called the magic moment by teachers like Sharon Salzberg, is noticing that you're on something different. Like when Michael noticed that, oh, I'm thinking of my back, not of the neutral thing. I want to redirect to the neutral thing. And noticing that without judging, that's the hard part, like just, oh, kind of like a curiosity, like, oh, I get it. Here's where I need to be mindful. Here's where I'd like to redirect my attention. And that noticing allows you to make a choice, the choice to shift your attention. And that's key, that when we're mindless, we don't notice, we don't have a choice. When you're brushing your teeth mindlessly, which is something we all probably do mindlessly, that's fine because, you know, we can rock along in that exercise. We've done it hundreds and hundreds of times, except it's not so fine when you're being so mindless that your toothbrush slips and now you've scraped your gum, right? So sometimes we get too mindless. When we slow down and pay attention, that gives us the opportunity to make that choice. All right, any questions or any other feedback about that first exercise before we go to the next one? Okay, so the next exercise is going to use your senses. And what is nice about our senses, our 5 senses of sight, hearing, touch, taste, and smell, is that they're always with us, like our breath. And you'll notice that I'm not really using breath in this program, mainly because people know, I think, that if I want to be mindful, focus on my breath, and that's probably one of the hardest things for people to focus on. You always have the option of using your breath, and I'm happy to talk more about that at some point. We're going to use our other senses. So I'm going to ask you to, we'll start with sight. I want to ask you to take a look around your room as I talk and simply pick out 5 objects that you can name. You don't have to say it out loud. I'll go around and name the objects as I look at it. It doesn't matter what they are. So I'm going to look around and see clock, cup, computer mouse, bag, book, photograph. So I'm simply choosing where to place my attention. I'm going to add a little level of that for you and ask you to look around and name red things. And maybe there's not a lot of red in your room. It might be a little harder. I'm going to see what I can find. Ribbon, book. Not a lot of red in my room. You could also do round things. So as you look around, can you name 2 or 3 round things? So starting with 5 is just a starting point. You can name as many as you want. Again, it's the idea of, if your mind is racing, choosing where to place your attention. We're going to do it in a 5, 4, 3, 2, 1 way where we use all 5 of our senses. So we'll start again with sight. So look around and name 5 things. They could be the same things as before or different things. I'm going to look around: lamp, plug, shelf, envelope, drawers. And then 4 things that you can hear. And it's okay if you can't hear 4 things. One is probably my voice. I can hear my own voice. Since I'm in my basement, I have a space heater and I can hear that humming in the background. I can hear a little hum of my laptop as well. Just sending your attention out, looking for 4 things. If it's not 4 or if it's 5, either is okay. And then 3 things that you can feel. And that can be where you're seated, feeling the support under your body. That can be your clothes against your body. It might be your hands resting on your lap. And then the last two might be more challenging if you just don't have any particular sensation in those areas right now. So two things you can smell. So I can't really smell anything here in my basement, which is probably a good thing. But maybe you smell your shampoo, maybe there's a scent of clothing, maybe you put on some kind of cologne this morning. And then lastly, one thing that you can taste. And that is often the last thing we had to taste. I have a little bit of minty taste in my mouth from a mint I had. Maybe you had coffee or tea. Okay, so that's the exercise. It's the idea of using your senses to really distract your brain from whatever maybe the chaos that's going on to something specific, to a specific task. What was that one like?
This one helped me. My mind didn't wander as much. I was able to, because I had a task, multiple tasks, that really helped me stay focused and help me clear my mind to just focus on those different senses. So.
Yeah, thank you, Sarah. So yeah, sometimes it's really useful when you feel like I can't, even when you feel like I can't clear my mind, maybe allowing the things you can't clear to be in the background, but your front brain is dealing with this task. Okay, I don't have to get rid of those thoughts, but I'm going to redirect my energy, my attention to just this really neutral task, right? And we could do it more specifically with like, I'm going to do a Sudoku or a crossword puzzle or something like that. This is a very neutral and accessible thing that you can do anytime. And you can, if there's one sense that stood out to you, you can just use that sense. It doesn't matter. You might have heard of like a sound meditation where a gong is played and you just focus on the sound. So there's no one right or way to do it. And that's pretty much true of all of these exercises. In fact, I think tailoring them to you, it makes it even better. Any other feedback about that one?
It kind of made me smile. I'm looking around and I see my grandson's toys. So, and you know, the blanket that my mom had made, and so it was comforting.
Oh, beautiful. I love that, Beth. So you really, when you looked around, you searched for kind of meaningful things. And you could, that's another tweak that you could add on it. Like I say neutral because neutral sometimes is more accessible. And if we're in a mood where, you know, we're in a bad mood or an angry mood or, you know, a sad mood, it might be harder to find those like, oh, let me look around and find things that make me happy. But if that works for you, that's a great way to do it, right? Look around and like, I have my niece's picture here. I can see things that make me happy too. That's things that make me smile. So either way, like, I think start with neutral, and then if it works for you to step that up, absolutely. Anything else about that one? And so again, this idea of looking for the neutral is to help us overcome our tendency to go to what's wrong and the most negative. And so that's really the focus of the next exercise we're going to do. This is called HEAL, Savor the Good with HEAL. HEAL is an acronym that I'll be telling you all a little bit about. So this comes from the work of Dr. Rick Hanson. He's a fellow psychologist who does a lot of work in neuropsychology. I really love his work. So I'm a huge fan of his work and his books. So the idea of HEAL is, you know, I mentioned the negativity bias that we tend to go to the negative. And what Dr. Hanson says is because of how our brains have developed, they've become like Velcro for negative things. Like if something negative happens, that sticks to us. If I asked you to tell me, name 5 things that went wrong yesterday, boop, 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 you get it, right? We all have that. If I asked you to name 5 things that went right yesterday, I'm imagining it would be more of a challenge. And so the flip side that Dr. Hanson says is when it comes to positive experiences, they slide off. It's like Teflon or oil, however you want to describe it. They happen, even the tiny neutral positive experiences, like I walk outside and it's sunny, like that, they happen all the time. And we often notice them, yet not for long. So that's the idea of this HEAL exercise. So as we go through the acronym, the first thing I'm going to ask you to do is to call to mind something that's happened recently in the past day or two that was positive. keeping in mind, it doesn't have to be like the huge positive. Like I got an award, or those things we notice a little bit more. Think about the small, simple positive. I had a great cup of coffee. Thank you for sharing that, Dave. I had a great cup of coffee. I watched my favorite show last night. My grandchild said, "I love you" to me. You know, the small positives that happen. So call to mind something that happened the last day or two. And that is actually the first step of HEAL, which is the H, which is have a positive experience. Again, we have them, they're there. It's simply the idea of noticing. So call that to mind. And once you call that to mind, the E is enhance. This is where instead of like, oh yeah, that happened, and we move right on, we stay with the positive experience. And that staying with it can be as little as 30 to 40 seconds. It doesn't have to be, we spend, we journal about it or spend 20 minutes thinking about it, although those things are great. Just stay with it a little bit longer. So remember the details of whatever it was you called to mind. Like, oh, somebody told me I love you, and that was so sweet, and it was unexpected, and it made me feel brighter when it happened, whatever it was. And then the A in HEAL is to absorb. And so that's where we enhance and savor a little bit further by noticing how our body feels based on that experience. Beth noticed when she was looking around the room that it brought a smile to her face. Maybe as you're thinking about the experience now, you feel a little bit of a smile. Maybe you feel something sort of in your core, your heart, your chest area, just a warmth or a tingling. Maybe as soon as you brought it to mind, you felt a release in your shoulders or a relaxing some other area of your body. So we tend to hold, like we hold tension and negative things, we tend to hold positive things in our body as well. So take the opportunity to notice that. And then by building up these first three letters of HEAL, the last letter, L, stands for link. And link is where we can come back to this. We can link to it when it's the end of the day and we say, nothing went right today, it was a terrible day. We see that little glimmer of, well, that was good. That was one good thing. Knowing that this is not intended at all to invalidate the bad things. Like I said earlier, if you've got that, you already are aware of the bad things. So we're not trying to ignore them. They're already there. We're trying to add in this memory, this knowledge, this savoring of the things that are also good. So that is the HEAL exercise. How did that go for you? What was that like? Thank you, Dave. And while I just mentioned about Dr. Hansen too, he has a wonderful book called Just One Thing. And the practices are, each chapter is 2 to 3 pages long, and the whole intention is short practices that you can add to your everyday life. There's 52 of them. So last year, I read a chapter a year. I should be doing that again this year, but I've gotten away from it, trying to internalize some of those things. They're really simple things like this HEAL technique. Was it hard to do that? Was it hard to call to mind something?
For me, I found that I kept changing what I was thinking about, but maybe I guess that's good too. It brought to mind a lot of different positive things that happened, but it was a little hard for me to focus and expand on just one.
Yeah, Sarah, that does sound like it may have been a positive thing, that as you started thinking about one, other things came to mind. That's wonderful. Like, the goal is to remember those things more, right? So it sounds like you're absolutely on the right track. And maybe, given that you've given yourself that little boost already, next time something spontaneously positive happens, see if you can stay with it just a little bit. Again, it can be under a minute. It's just like, oh, wow, that felt good. I noticed my body feels warm. I feel tingly here. So see if you can take that forward. I think that's a great start. Anything else? Any other things that went well in trying to do that or that were more challenging? Was it hard to think of something in the past day or two?
I went very intellectual on this one, because it reminds me of what I teach my students in relation to behavior and classroom management, meaning focus on the positive behavior we want to see as opposed to focusing on the negative behavior. And I was always surprised to feel like that much energy when I kind of perseverated on the positive experience, the positive happening.
Yeah, that's a great point. Thank you, Michael. Yeah, I'm sure teaching teachers to enhance the positive, and certainly that has roots in psychology as well, right? For behavioral change, like do more of what you want to see rather than focusing on what you don't want to see. You know, I think for couples counseling, there's a lot of wisdom there as well, which just shows how this simple technique that's really designed to kind of give you more good feelings and help you be more mindful of good events can have far-reaching implications to a lot of different areas in your life. All right, anything else about that one?
I just wanted to shout out to Dave. Thanks for putting the links in there to Rick Hanson's websites in the chat. Thank you.
So the last thing I want to do before we wrap up, and then we'll go into again the 10-minute guided visualization for at the end. It usually involves standing up, but I realize that not everybody might be comfortable standing up, and Sarah might not be able to right now. You can practice. You don't have to practice it right now with me if you don't want to. And if you can't stand up, you can try it seated. I don't know if you can do it holding a baby, but
Sorry, I didn't want to distract it.
No, who doesn't have good feelings now? I'm going to stand up. Feel free to join me or not. This is based on the work of Amy Cuddy, and she has a TED Talk, and I'm sure before I even finish the statement, Dave will link to that eventually. So I'm going to stand up. This is called power posing. Let me see if I can. Okay. It's standing. My feet are wide apart. And then I'm going to put my hands on my hip. I like to think of this as Wonder Woman pose. You can be, whatever kind of superhero you want. So Amy Cuddy's research is in social psychology. And she did a lot of, and just stay standing if you're standing. She did a lot of research into, yeah, I know, it feels weird. We'll see. There's method in the madness. The research is into the idea of how we hold our posture. And she looked at things like interviews and people, positions of power, and found that when people have a more open posture, they feel stronger, more confident, they feel they're able to speak with greater confidence. So her hypothesis, and there's been some controversy of it, but I personally still like it, is that standing in this way, in this power posing, taking up space with your body for 2 minutes can put you in a position where you feel more energetic, more powerful. And I'll share, coming from yoga background, I'll share a background of a class I went to this Saturday where we did a version of this, feet apart, toes turned out, and our arms were also spaced, like looking up and wide. And one of the students in the class said as soon as she did that, she just felt more open and expansive and energetic. And I think, we have 6 feet right now, so why not take up all of that space that we can? All right, so if you were doing that with me, you can sit back down. And you can incorporate this seated. Again, just when you notice you're sitting in a very closed posture, you can sit with some openness. You can spread your legs, spread your arms, put your hands on your hips, and stay like that for a few minutes and see what it feels in your body. Also a strategy you can impart to, like, have your class stand up and just take up space for a minute or two. So how did that last thing feel? I know, probably a little silly. In addition to the silliness, how did that feel?
I watch a show, Grey's Anatomy. Mm-hmm. They did it in that show.
I heard that. Somebody, a student told me that.
And I've done it before. I did it before I applied to this job that I have now to kind of help me feel like, yeah, I got this. I'm powerful. I'm confident, and
must have worked.
So it's a good thing, women, and I'm sure men too, but I know women, they can be so hard on themselves, it's easy to think negatively and critically. So it's important to, and by, putting yourself in that position, it's just easier to look up and feel powerful. And yeah, so I like that one a lot.
Absolutely. Thank you for sharing that. And Amy Cuddy's research did find some gender differences that sometimes it's these things are more challenging for those who identify as women. So that can be a factor. I'm glad you brought up the Grey's Anatomy reference. I don't watch the show, but somebody had told me that, and I remember looking it up. And I think it's all of the medical staff, right? Aren't they standing that way before surgery, maybe, or a procedure? So I love that idea. I think it's great. That's something you do like before an exam, do with your class before they go into student teaching the first time. So I think there are a lot of applications and a lot of variability. It doesn't have to be hands on hips. I kind of like this big wide position too, so it can be adapted to just this idea of, hey, you don't have to be small in stature. Take up your space. All right. Any other comments about the power posing? And then we'll kind of wrap things up, and then we'll have the time for our final guided meditation. All right. So the wrapping things up is mainly going to be some of the things I said in the beginning, right? Is finding ways to establish being mindful as an everyday habit. And it can be tuning into something you're already doing. Like I mentioned the teeth brushing, because I'm assuming that we all do that. You can choose that when I brush my teeth today, I'm going to be mindful. And that simply means keeping your attention on that activity and just that activity. You can use the senses like we talked about, feeling the tooth, the brushing of the teeth. If you're looking in the mirror, noticing what you see, hearing the back and forth of the brush. I'm sure there's smell and taste involved in brushing your teeth too. So choosing an everyday activity that you already do, that can be a great place to start with mindfulness. Knowing that your attention will get distracted. You'll start thinking of what you have to do for the day, or if it's the end of the day, how the day went. Giving yourself kindness and compassion that is normal, and knowing that if you notice that you got distracted, you have made a step forward. You have strengthened your muscle a little bit more. You have advanced yourself, and you can bring yourself back. So you can also find ways to check in with regular intervals with yourself. One is an activity, or linking to an activity, like every time before I eat, I'm going to close my eyes and feel my feet. It kind of rhymes. So every time before you have a meal, you're going to take a minute, close your eyes, and feel something neutral in your body. So that could be a way of linking it at a regular time. You also set a timer on your phone. We might all be all a little sick of technology right now, but if that is something that helps you remember to take that time out and pause, and that's the idea, is finding that brief time to pause. And as I said in the beginning, absolutely do longer practices when you have more time. If you can do a 10 to 15 minute meditation, there are lots of ways to do that with, there's YouTube, there's apps. I have a YouTube channel if anyone wants to check out my offerings. And I have both yoga and meditation. The meditations are also about 10 minutes or less. So they're definitely short, definitely things that you can work in. They're all at a really basic mindfulness kind of level. I like to think of setting yourself up for success. This is probably totally different from like an athlete or coach mindset, but since I've never been an athlete, I can say this. I like to think of setting the bar low. That's my goal. Set the bar low, allow yourself to succeed when you try something new like this. And then once you accomplish it, then you can go for higher. So if you could set the bar for, before I go to bed, I'm going to take 1 mindful minute to reflect on something that went well that day, that's huge. And then if you want to do 2 things or do it some other time during the day, you can build on that first small success. And as I've talked about, find what works best for you. If there's one of these exercises that didn't it didn't work, you didn't resonate, you didn't like it for whatever reason, you don't need a reason. Choose what works, and that includes what's worked for you in the past. So you may have done something previously. Maybe you were in college and there was a time that you were able to practice some mindful skills. Draw them back to your present. See if you can adapt them. See if those things would still work for you. All right, so any questions or final comments before we go into the last activity? Thank you for the promotion, Dave.
It was actually specifically asked for too, so
Thank you.
in a private chat. Beth, I wanted to say I actually really appreciate these sessions. You know, one thing that really struck me is this idea that, you know, your brain is very good at holding on to these negative thoughts, and it's great to kind of come up with strategies to focus more on
Hello, I'm Beth.
being ways that you can be more mindful of that. I also I can really see this going well in the classroom. I know a lot of times when I'm teaching, you know, oftentimes, you know, you're running from meeting to meeting, you know, you're rushing to a class, you're hurrying to get set up for class, you know, get your presentation ready, get your slides all set. Um, I love this idea of even just starting a class with this some sort of brief mindful activity to really kind of, as you've said before in sessions, this power of the pause, to kind of focus your thinking, um, be present in the state where you are, kind of stop some of those racing thoughts, and then continue on with the task. I'm sure it'd be great for the students too.
Yeah, I love that. If every professor took a minute to do some kind of mindful tune-in at the start of class, yeah, that makes my job as a therapist easier, right? The more we get that out there, the more we teach these skills, the more prevention that we're doing. I think the more, you know, the happier and satisfied we'll all have in our lives. Thank you for that, Dave. Well, after we do the guided, I will stay around. So if anybody else has any other questions or wants to ask me any questions about my YouTube or my yoga teaching. Usually I do teach a weekly yoga class on campus that's open to everyone, faculty, staff, students. I think it's really important for us all to practice together and have that mindful practice. I have not been able to do that since last March. I'm looking forward to eventually being able to do that again, although we did offer a couple outdoor classes in September. And if the weather allows later this semester, maybe we'll see about that. So for this last activity, this is going to be a guided visualization. You're welcome to stay on camera if you'd like. You're also welcome to go off camera. And then if you have any questions for me when it's over, you can come back on, whatever you're more comfortable with.